Hello and welcome. My name is Shelby. I've been working with Dr. David Spiegel for the last 3 years on Reverie, which is his legacy project, and it's the app that's changing people's lives. And it makes his methodology accessible to all. Whether you've used Reverie for the last 3 years or you don't even know what Reverie is, you are welcome to be here today. We're glad to have you. And today's workshop really is for everybody. Chronic pain is something that is estimated to affect about 20% of the world's population at any given time. And pain is something that affects all of us in our lives at one time or another. So it is clearly a widespread phenomenon, and we need something to address it. We really hope that all of you will walk away today's session with real, effective, actionable skills that you can apply in your life to alleviate pain. So, again, we're talking science based, non pharmacological methods for pain management. And this stuff really, really works. Without further ado, I will pass it over to Dr. Spiegel.
Thank you, Shelby. It's a pleasure to be here. I see some good friends of mine listening. We're delighted to have you here. The strain and pain lies mainly in the brain. And one of the problems that many people with pain have is that if they use a technique like hypnosis to reduce their pain or even eliminate it, they tend to think, and others tend to think, it was all in their head. Well, in a way it is, because all sensory input that we have is processed by the brain. But the fact that you can learn to control it using brain techniques like self-hypnosis doesn't mean the pain isn't real. So what I'll do is describe a little bit about pain pathways, how they're processed, and what we can do using hypnosis to help deal with pain. Pain signals usually start in the lateral spinal thalamic tract, small delta fibers, which conduct relatively slowly, send an initial signal toward the brain. You may have noticed, for example, that if you stub your toe, there's that couple of seconds where you think, oh, this is going to hurt, and then you feel a burst of pain. That's because the larger fibers, the alpha neural fibers, travel by a different pathway in the spinal cord to the brain, and the signals are transmitted faster. So you know what position your toe is in juxtaposition to that rock, but it hasn't quite yet hurt because the delta fibers are transmitting the pain signals through the lateral spinal thalamic tract, through the brainstem, the periaqueductal gray, up to somatosensory cortex. So the brain has this complex system. There's a pain network that involves the dorsal anterior cingulate cortex. The cingulate cortex is like a C on its ends in the middle of the brain. The dorsal part is part of the pain network, and the insula, it's connected to the insula, which is a little island of tissue in the middle of the front of the brain. And they help generate pain signals. And there are two types of pain signals that the brain processes. One of them is sensory discriminative. You know you did something and it hurts. And that's processed in the somatosensory cortex in the parietal lobe on the left and right backside of the brain. But there's a cognitive affective system of pain. How does it feel? Does it bother me? What does it mean? That's processed in the insula, in the anterior cingulate cortex, and in the amygdala and the prefrontal cortex as well. The amygdala is a deep structure in the brain that handles emotion, including anger and fear. And the brain sorts out these signals in these two regions and processes them relatively independently. What this means is that pain is a complex experience that involves sensing what's happening in some part of your body and also evaluating its meaning and how you feel about it. Now, because we human beings are relatively pathetic physical creatures, our capacity to detect injury and do something about it, including modulate it, has been linked to our survival throughout millennia. And the fact that the brain can modulate pain, the fact that it can sort out just the physical sensation on the one hand and the emotional implication of pain has been important for survival. Knowing when you've been hurt, when you should fight or flee are important means of surviving. So it's important to be able to recognize pain. And there are factors that can make pain better or worse. For example, if you become frustrated, angry, frightened by what the pain means, it will actually make the pain literally feel worse. And on the other hand, if you're relatively sure that there's nothing serious going on and you can handle it, it can make the pain actually feel less bad. And so the brain has mechanisms of modulating the pain experience. And one of the common feedback cycles that can make pain worse is fear, anger, or frustration, the emotional component of pain, where you can literally make the pain feel worse because you're so worried about it. And the brain tends to process all pain initially as if it were acute pain. So if you just broke your ankle, it's good for you to know that and get some help with it. But after a while, the same amount of pain response is not relevant as your ankle is hopefully healing. And yet you can associate it with those early experiences of acute injury. And the more you pay attention to pain, the more it hurts. The more frustrated and angry or despairing you are with the pain, the more pain you'll experience. So the brain has signal networks that will either intensify or can relieve pain. And that's where hypnosis comes in. Hypnosis is a state of highly focused attention. It's something like getting so caught up in a good movie that you forget you're watching the movie and you enter the imagined world. It's been called believed in imagination. So the major component of hypnosis is highly focused attention. The second component that goes along with that is dissociation, the capacity to put outside of conscious awareness things that would ordinarily be in consciousness. Right now, let's do a little experiment. Until I mentioned it, did you notice the sensations in your body touching the chair you're sitting in? If you were aware throughout of your body touching the chair, we could probably stop now because it means you're bored. But I'm thinking that most of you were not even aware of it. So that's an example of how the brain can filter out relatively irrelevant information and just have you feel as though it weren't there. The sense signals are there. And if you can do that with your body touching the chair, you can do it with other signals, like pain signals as well. And so the second part of hypnosis is dissociation, putting outside of conscious awareness things that would ordinarily be in consciousness. The third part is what scares people the most about hypnosis, and that's what has been called suggestibility. Can a hypnotist make you do anything they want? And we are social creatures, and we are susceptible of social influence, with or without hypnosis. But hypnosis involves really not suggestibility, but cognitive flexibility. It means that you can experience the same situation in a variety of different ways. You can conceive of yourself as acting in a variety of different ways. And the way I'll try to describe this to you is what we know happens in the brain when you go into a state of hypnosis. Using functional magnetic resonance imaging, we've studied people in the hypnotic state. They turn down activity in the dorsal part of the anterior cingulate cortex, right up here. And that's part of the salience network. It's our brain's alarm system. So if you hear a loud noise like that, your salience network fires off and says, what's going on? Do I need to do anything about it? And when you turn down activity in that region, you're calmer, you're more relaxed, you're able to focus your attention more intensely because you're less worried about something else that could be a threat or a risk of some kind. The second is with dissociation involves the ability to put outside of conscious awareness things that would be in consciousness. The prefrontal cortex is hyper-connected to the insula, which is a part of the brain that senses information from within the body. And it can suppress activity in the insula so that you're less likely to feel or respond to things that otherwise you would pay attention to. The third thing that happens is the prefrontal cortex, the executive control network in the brain, the one I'm hopefully using and talking to you now, has inverse connectivity with a part of the brain in the back of the cingulate cortex called the posterior cingulate. And that's part of what we call the default mode network. It's a part of the brain when you're not working, when you're not doing anything else, when you're just reflecting on who you are, what your mother wanted you to be and all that, that is active when the rest of your brain is relatively inactive. And the default mode network, you're reflecting on who you are, what you should be doing, what you can do. I sometimes think of it as the my fault mode network, where you speculate about what's wrong with you. And in hypnosis, you can suppress activity in that part of the brain. And when you do that, you can try out being different. And as a psychiatrist and physician, I love it when my patients are in a state where they're in a mood to try out being different, when they can let go of their presuppositions about what they can do and what they can't do. And that has to do with pain. So pain is a signal. It's real. It's problematic for many people. And I gather a lot of you have back pain, some of you lower leg pain, other kinds of pain as well. And of course, that's something you have to deal with, but it's something your brain can help you deal with. And so I'm asking you now to suspend disbelief for a moment and try out the ways in which your brain can help you modulate the pain experience. We have evidence, again, from functional MRI, PET, and EEG, that the brain can actually modulate pain. So the experiences that you've had that allow you to modulate pain represent brain states you can get into with or without a medication or something else that can help you modulate the pain experience you have using self-hypnosis. And we've been able to show using EEG and MRI that when you modulate pain signals in that way, you actually alter the way the brain responds to the same signals, turns down the response. So that experience is something that you often associate with, remembering your discomfort, but it also is a good way of remembering and mobilizing your brain's activity to make your body more comfortable. What we're finding is that there are simple techniques that you can use to reduce the stress associated with pain and also the pain perception itself involving self-hypnosis, highly focused attention, dissociation, and cognitive flexibility. So open your minds a little and let's see what we can do together. So first, get as comfortable as you can. And now while you're sitting comfortably, look up to the top of your head, all the way up high as you can. And as you keep looking up, slowly close your eyes. Close, close, close. Take a deep breath in through your nose. Hold, and then slowly exhale through your mouth. Again, another deep breath in through your nose. Fill your lungs. And slowly exhale through your mouth. Now imagine your body floating somewhere safe and comfortable, like a bath, a lake, a hot tub, or just floating in space. Another deep breath in. Hold and slow exhale through your mouth. Imagine you're floating. Favorite place for you to feel comfortable: a warm bath, a hot tub, an icy mountain lake, lying on the beach in the sun. And as you're now floating and comfortable, I want you to take one hand and stroke the back of the other hand. So take your right hand, for example, and stroke the back of your left hand and let it float up in the air like a balloon, as though you tied a balloon to your wrist. And I'm going to give you this instruction that your hand will remain light and in this upright position, even after I give you this signal for your eyes to open. If I ask you to pull your hand back down, it will float right back up to the upright position. You'll find something pleasant and amusing about this sensation. And later, when I ask you to touch your elbow, your usual sensation and control will return. Another nice deep breath in. Hold. Now slowly exhale through your mouth. And now let's try a little experiment. Just hold your hand down and let go and see what happens. And for many of you, you may notice a change in sensation and control in your hand and arm. And for those of you who don't have that experience, just notice the sensations that you do have in the hand and arm that we're focusing on. Get in a nice, comfortable, upright position. And I want you to picture your body being in a place where you naturally feel relaxed and comfortable. I want you to feel now a sense of warm or cool, tingling numbness. So if you have pain somewhere in your body, just substitute the sense of warm or cool, tingling numbness. and let it filter the hurt out of the pain. Another nice deep breath in, slow exhale out, slow exhale out through your mouth. Filter the hurt out of the pain. Now, another thing you can do to help with your pain is to imagine that you can leave your body here and go somewhere else in your imagination. Picture yourself on a desert island or in the mountains, enjoying the view. But just, in a sense, take leave of your body, leave it there, comfortable and floating, and go somewhere else. And again, as you do this, please notice the sensations you are feeling in your body. See if there's any difference, just as there may be a difference in your hand floating in the air. Another thing you can do is try to move the pain around if you're still feeling it. Move it to an adjacent part of your body and see if it feels different in some way. Make the area of the pain smaller. Change the nature of the sensation. Filter the hurt out of the pain. And finally, I want you to imagine that you're a parent to your own body and your body is your child. Find it in your heart to forgive your body for causing you discomfort. If you had a little child who was hurt, who fell down and hurt himself or herself, you wouldn't get frustrated and angry with your child. You would soothe and comfort them. So imagine just soothing and comforting your body. It's doing the best it can. So if, for example, you had pain in your back, think of the things that give your back relief from pain, like a warm bath or an ice pack. And imagine that you're in the warm bath or applying the ice pack. Or take a little vacation from your body and just imagine you're somewhere else. Or try and alter the pain in some way if it's still there. And develop a sense of compassion for your body the way you naturally have for a child who's been hurt. And in these ways, you can learn to filter the hurt out of the pain so that you both feel less pain and your sense of stress and anxiety and concern about the pain can be changed. Now, this is an exercise that you can do every 1 to 2 hours or anytime the pain is bothering you. Don't fight it, admit it. But sit down or lie down, go into this state of self-hypnosis and learn to filter the hurt out of the pain. Utilize your experiences of actual pain relief to cue up the same brain settings that you have when you're doing those things. And let your brain manage the pain and attend to other things you'd rather pay attention to. Filter the hurt out of the pain. Now, please take one hand and touch the elbow of the hand that we paid attention to earlier, either floating in the air or maybe down, but touch your elbow. And if your hand's still up, let it float back down. Take another deep breath in through your nose, hold, and now slowly exhale through your mouth. And please reflect now on how comfortable your body is on that scale from 1 to 10. Just evaluate your pain and any change you may have experienced during this exercise. Your hand is back down, make a fist open it. Now we'll come out of the state of self-hypnosis together, counting backwards from 3 to 1. On 3, you'll get ready. 2, with your eyelids closed. Roll up your eyes and now open your eyes and let your eyes come back to their normal level. 3, 2, 1. Okay. Anybody still floating in the air? Brenda's asking, does this help with neurological disease symptoms, tremors? Yes, the answer is it can. Because when people have these neurological symptoms like Parkinson's or MS, for example, there is a problem with the nervous system. There's a discontrol of nervous and neuromuscular function, but your level of stress can either amplify or diminish that. So, for example, people with MS who get weak at times find that the worst time is when they have to get on a bus, when they're under pressure to perform and their symptom actually gets worse. So if you can help yourself feel relaxed and comfortable, you can reduce even real neurological symptoms. And pain is a real neurological symptom, but you can manage it the way you've experienced it. And there are kinds of epilepsy where hypnosis can be helpful, actually. People can learn to, typically they say, I can't stop it, but they can sometimes start it in hypnosis and then gradually modulate it and make the seizure that comes less and less strong. There are other people who can't control it. There's a seizure focus and it needs either a medication or neurological implant to control it. But there are some kinds of epilepsy that are either a combination of the two or just a kind of extreme stress reaction that hypnosis can be of help with. Can hypnosis help with stress-induced headache? Yes, Shreya, it can. For example, those of you who have migraine headaches, it's often you may find that when you're having a migraine or developing it, you get the photophobia, the fear of bright light. You also often sometimes feel heat in your head, and that makes you more uncomfortable. It can make the headache worse. And I have people with migraines picture that they have an ice cap on the top of their head in hypnosis and feel a cool, tingling numbness penetrating deeper and deeper into their scalp. And many people with migraine get relief from that. I had one patient recently who said, I've been meditating for 10 years. I've done it twice a day for 10 years and I still have migraines. I like meditating. I feel good when I do it, but I still have migraines. So I taught her to use the ice cap self-hypnosis. And she called me back and she said, my migraines are gone. Thank you. And thank you for freeing me to use my intentionality. There's a sense often in meditation that you're not supposed to try and change anything. You're just supposed to have open presence to whatever's happening. And hypnosis is different in that you use it for a purpose to solve a problem if you can. And so she was able to combine the two and did very well with it.
Amazing. The questions are really flowing in now. One that Andrea flagged from the chat is a really good one, which is that this person said, my concern is that some of the pains are there to signal. I don't want to ignore them by mistake since it's easy to not feel the pain.
It's a very good question. The pains are there for a reason. And sometimes, especially with novel pain, it's a good idea to investigate what might be causing it. So you might have a disc problem in your back. You may be squeezing the nerve roots if the disc is moved or damaged. And there are times when you need to know that to get definitive treatment to help or at least relieve the pain symptoms. So yes, pain is a useful signal. It's just like, when somebody gives you bad news, it's uncomfortable, it's unpleasant, but you need to know the news. So I would say it is important, particularly when you have a new pain, a novel pain, that you do what you need to do to figure out what's causing it and try and prevent any damage to your body. Pain signals can be very useful. But you can, at the same time, once you know what it is, you can then learn to modulate it and say, I got the message, but I don't need to keep reading it over and over again. I got it, and I'll act on it if I need to, but I'll make my body more comfortable. The question was, can pain meds help? Can you combine them with hypnosis? And the answer is yes. We've done studies that show that, for example, patients undergoing surgery that doesn't involve general anesthesia can combine lower amounts of opioids with hypnosis and get very effective pain and anxiety relief. So it doesn't have to be one or the other. If the pain meds sedate you so much you can't concentrate well, then it may be hard to use the hypnosis, but otherwise you can. I see you've asked about why the hand floating in the air. We use it as an indication that you're shifting into a hypnotic state. And it's a way of showing in an area that doesn't have the conflict around pain itself to see whether you can actually change the way your body feels and its control mechanism. So it's a way of showing yourself to what extent you're able to go into a hypnotic state and have your body react to it. And then go on from there to see what you can do to control the pain. Are there other questions or?
Yeah, there are a lot. So, how long can one stay in the state of self hypnosis? I'm guessing Robert means at a single time.
Well, you can typically the hypnosis sessions will last for, 5 to maybe 15 minutes. It doesn't have to be that long. You don't need the old idea about hypnosis was you had to, count upstairs and downstairs and take a long time to deepen in your hypnotic experience. Basically, while people differ in their ability to experience hypnosis, you can actually get into a hypnotic state at your level of hypnotizability very quickly. So you don't have to take that long. Just do it long enough to feel the change in your mental state and in your physical state and use that change to help yourself be more comfortable, to manage stress better, for example. I teach people to start out dealing with not the stressor itself, but the way your body is reacting to it. You can control that. So get your body floating safe and comfortable, and then picture what the stressor is on an imaginary screen and try out ways of dealing with the stressor on another part of the imaginary screen. So divide it in half, left the stressor, right, possible solutions. But begin by managing your physiological reaction to stress. So it doesn't have to take that long. Just do it long enough to see if you can get the effect. And then if you need it again, do it again. So I find it more helpful for people to not make an exceptionally long period of time, but a useful period of time where you feel how you can change the way your body feels and reacts to stimuli, including stressors and pain. But if you get a snowball effect, if you don't do that, if you get physically tense and then you worry some more and you think, oh my God, it must be really bad. My muscles are tighter. My body is starting to sweat, and it feeds on itself. So start out soothing your body the way you would soothe a troubled child, and then deal with whatever the stress is that's troubling you.
Is it normal for you to feel warmth around the area of pain?
Yes, it can be, and particularly with pain that's exacerbated by inflammation. So you'll notice, for example, if you have a sore on your body that is getting infected, starts to get red and feel hot. And that's these inflammatory cytokines that are part of the immune response to the infection, and that'll hurt. So it is not uncommon to have a sense of warmth associated with discomfort with certain kinds of pain, particularly involving infection. And therefore, you can make yourself more comfortable. Sure, one thing, maybe take an antibiotic or rub on an antibiotic cream, but also imagine the opposite physical sensation from the thing that makes you uncomfortable. So if you associate that localized warmth with pain, imagine an ice pack cooling it off, and you may find, as the migraine sufferers do, that you can reduce the pain by imagining a change in the temperature.
Great. And just following the session that we did a bit ago, Amy mentioned it just made the pain try to find new places to go. How might
Oh,
you address that?
well, you've got crafty pain, haven't you? Um, well, it may be, but what I would ask you, Amy, is as the pain is trying to find another place to be, has it changed in some way? Have you been able to change the pain? So, you might say it's sort of like the pain is trying to escape your brain's ability to control it. And it's pretty sneaky. It's trying to go somewhere else. But just the fact that you can manipulate it in that way is a sign that your brain has ability to control it. So, I'd rather it just disappeared, but it may be that you're on the path to figuring out how to better control it.
That leads me to another question that we hear a lot, which I know some people here might be wondering. Because some people mentioned, I feel relaxed, but it didn't change my pain much or at all. For those who this is their first experience with hypnosis and their pain is not reduced from that one session, is it possible that if they work at it, that they could get benefits from hypnosis for pain management down the line?
Sure, absolutely. It's certainly worth a try. The nice thing about this is there are no side effects. The worst thing that happens is it doesn't work, but it might work. And so it is worth taking a little more time and a few attempts to try and see whether you can manage and regulate the pain, filter the hurt out of the pain. So focus not on the pain itself or fighting the pain, but on filtering the hurt out and see if you find another metaphor. On Reverie, we have 4 different pain exercises. I went through a bit of each of them, but try if one doesn't work, another might. If you find that initially changing the temperature, trying to filter the hurt out doesn't work so well, try just leaving your body here saying, I'm tired of feeling this. I'm going to go somewhere else where I usually feel really good. And so imagine you're in a mountain lake or you're on a sunny beach and just see if you can detach your attention from the pain signal. So by all means, try playing with it and see if a different approach using self-hypnosis helps.
Thank you. Anita asked about her friend who injured her arm. And while she suffers chronic pain, that's something that she's able to handle, but it's the acute pain during physiotherapy that she finds stressful. And the doctor is trying to help her, but the pain is so severe that she says she's got it into her head that he's torturing her. What would you advise she does to overcome this?
Well, I would have a discussion with, is this like a physical therapist or a doctor is doing it?
Well,
I
she
would,
the physiotherapist.
doesn't say. I'm sorry?
She does mention the physiotherapist.
Okay. Yeah, well, they need feedback because they're not in your body and you are. And so a certain amount of discomfort may be associated with good physical therapy that will eventually help your body get better. On the other hand, don't be shy about letting them know that it's hurting more. And maybe they will learn something about the way in which they're manipulating that part of your body. So you have the right to communicate clearly, and if worse comes to worse, stop it if you just think it's making you worse. I would say that it's a difference also between how you feel during the procedure they're doing and how you feel afterwards. And if during the procedure, some discomfort may be necessary to do good physical therapy, but if you wind up just feeling miserable, worse than you were before, afterwards, it may be time to discuss it with your physical therapist or try a different one.
Thank you. And a couple people have asked about tremors. So sort of adjacent to pain, perhaps. Anna wanted to know what suggestion would be used with tremors to try to reduce.
Well, again, I would see if there's anything that occurs naturally in life for you that reduces the tremor. And when you have that, imagine then being in that situation. So maybe, for example, when you're in a warm bath, the tremor feels better. Or if you focus on sensations or emotions in another part of your body that isn't involved with the tremor, you can, it's a matter of sort of searching for a mental and physical experience that you can associate with relief from the tremor, like relief from the pain, and see if just imagining being in that situation actually has an effect on the tremor. I saw a movie once. It was a remarkable movie of a woman with advanced Parkinson's disease who had this, what we call a festinating gait and this marked tremor of her hands. And they suddenly loudly played her favorite song. And she suddenly starts just strutting along like she was dancing to it. And as soon as the music stopped, she was back with the tremor. And so there are situations in which other brain pathways get activated that can control it. And I've had patients with Parkinson's who, when they just imagine lying on the beach in Hawaii, one guy, it was so intense that he said, I'm getting salt water in my eyes. My eyes hurt, but his tremor stopped. So the level of arousal you have can influence a tremor one way or another.
A lot of people have, specific questions around if hypnosis can help with a stress-induced migraine, if it can help with period cramps, and if it can help with painful skin conditions. I'm guessing the answer is yes to all, but I'll let you speak to that.
Yeah, you're absolutely right, Shelby. That for all of these situations, painful skin condition, is there something that you rub on your skin that actually makes it feel better? Well, just imagine you're doing it or remember the last time you did that because the reduction in pain has to do with, for example, the pain relief from whatever ointment you're putting on it. But your brain was in a different state when that happened. And it's not all about the peripheral input. It's about the way you respond to it. And it may be, for example, you'll notice that just thinking about being able to put this pain relieving salve on your skin, you already start to feel better because you know you've got some control over it. So just do that mental act in self hypnosis and see if it helps.
Great. We have an upvote on the following question. Does having interoception differences influence the effects of the brain feeling pain, like more active pain receptors?
Yes, there's no question. Interoception is mediated in the insula, which is a part of the brain that's a little island of tissue. Insula means island in Latin, that transmits signals, including pain, from the body to the brain, and also transmits brain instructions to the body. And so it's a very important relay. It's a part of the salience network and the pain network that is susceptible of influence on the basis of mental experience. And so your brain can control how much discomfort you feel just the way it controls what parts of your body at any one moment you're paying attention to. So, yes, it is possible to use input and output from the insula for the brain to better control what's going on in the body and how the brain reacts to it.
Great. Thank you. Another question was if hypnosis can help with chronic fatigue and long COVID.
I've not seen a whole lot of evidence about effects of hypnosis on long COVID, chronic fatigue. It becomes more difficult to concentrate. So with long COVID and chronic fatigue, some people find that they just have trouble using their brains as actively as before. And that does tend to impair your ability to use it for hypnosis too. Again, I would say I don't have much evidence about that the way we do have about pain. But again, I would say no harm in trying. And so if there are moments, for example, during your day when you have long COVID, when you felt better, when you felt more energetic, try reliving those moments and see if you can help your brain have more of those moments. See what it's like to relive that time during the day or night when your brain seemed to be working better and try using it that way.
Thank you. And the last question I'm going to ask is from Alex. Can hypnosis be effective long term without diminishing returns?
Yes, absolutely. We have a fair amount of evidence about that, including studying thousands of people who have used Reverie. And when our biostatistician looked at the improvement in pain and the reductions in stress, it was about 4 out of 5 people felt better within 10 minutes after they started using it. And most of the rest of them just didn't feel worse. They just didn't feel better, but 4 out of 5 felt better and an average 15% reduction in pain and stress. And our biostatistician looked at these data when they did it the first time, the second time, the third time. And she said, what's remarkable is how consistent the response is. So the answer is absolutely. And that's the nice thing about hypnosis. You can use it quickly anytime you want, and you can count on getting the same experience of improvement that you had the first time you did it. So it is very much worth making it a practice that and you do it when the pain is just starting to get bad. Don't wait for it to get terrible. Try doing the hypnosis when you start to feel it again, and do it early and often. Whenever you start to notice the discomfort, manage it.
Thank you, Dr. Spiegel, and thank you to everybody who participated today. Thanks to all of you for your questions and for trying hypnosis. For those of you who it was your first time, Hopefully, you'll be able to put yourself in the state of self hypnosis and use this skill whenever you need it in your life. And just imagine what's possible if you keep practicing. So, if you want to keep going, we are offering 30% off all yearly and lifetime plans if you want to get into the Reverie app and access all of our new sessions on pain management. As I mentioned in the chat, we also have a new session on managing depression, which we know can be correlated with pain. So use the code FEELGOOD at checkout on our website if you want to redeem 30% off. And we'll pop a link in the chat as well so you know where to go to get started. And again, thank you all for being here. This was incredible. Thank you, Dr. Spiegel.
My pleasure. Thank you for joining us.
Goodbye, everybody. We'll see you soon.
Bye-bye.